Shannon Kennedy. I'm an internal medicine doctor at Remedy Wellness Center. Today I wanted to talk to you about preparing for your telemedicine visits. By now, most of you have probably participated in telemedicine with your healthcare provider, and there's a few things that you can do before your next visit, that can help make the time more productive. So one of the first things you can do is collect some signs. Signs are objective findings. They're usually numbers that you can record. One of the devices that you might have at home, or you should get if you don't have one, especially in this day and age, is a thermometer. They were very difficult to come by a few months ago. They're back on the shelves. You can order one online. This one's rather neat because you don't have to touch anyone with it, and you can screen friends and family before they come in your home to make sure nobody has a fever, for the people who you're not socially distancing with. 97.5, that's pretty good. Another device that's not very expensive and is readily available at most pharmacies, or you could also order online, is called a pulse oximeter. Pulse oximeter, put on your finger and it measures your oxygen saturation as well as your heart rate. And you just put it on your finger. You have to hold still for a little bit. Sometimes when you first put it on your finger, it'll read a lower number, and it's calibrating and it's trying to get a better read. So let it sit there quietly for 30 seconds or so before you look at the number. Also note that a lot of times, depending on how you hold your hand, you're looking at the number upside down. So your oxygen saturations are not 66%. They are in fact 99% if you look at them the other way. So those are a few tips on reading your vital signs at home. 99%, that's really good. Heart rate 96, that's a little high for me sitting still, but I'm a little nervous doing this video. So third thing would be a blood pressure cuff. We use manual blood pressure cuffs in the office, which means we have a stethoscope and we pump it up and we listen to the sound in your arm and determine what your blood pressure is. At home, that's very difficult to do. So we encourage you to get an electronic cuff. They are also available at pharmacies. Usually insurance doesn't cover them. People ask for prescriptions for a blood pressure cuff. If you have certain medical conditions and certain insurance plans, they'll cover it. But otherwise, it's a good investment. It's a good investment. Good idea to have one at home. We encourage you to get a cuff that goes around the upper part of your arm, but even if you get one that goes around the lower part of your arm, the good thing is that you have a baseline reading of what your blood pressure is when you're feeling good, and that way when you're not feeling good, you can put that blood pressure cuff on. If your normal reading is 110/70, and every time you check it, once a week, once a month, it's 110/70, and one day you're not feeling good and you check it and it's 140/90, even though that's not a really high number for you, that is different. And that's a really good objective sign to report to your doctor. So I encourage you to have these three things at home. I also encourage you to have a scale. I don't like having a scale at home, but it's important. It's a reality check, and it's something that helps determine where you are, not just for weight and as far as eating or gaining fat, but also for swelling and inflammation. There are times when you may gain 5 pounds in a few days due to inflammation, due to maybe something that you've eaten or something that you were exposed to. It's really hard to gain 5 pounds of fat in 3 days, but if you go from 140 to 145 pounds and you're eating a lot of gluten, a lot of pizza, some bagels, and your joints are achy and you don't feel good, and you get on the scale and you've gained that much weight in 3 days, that's a reality check. That's like, maybe I should cut out these inflammatory lifestyle choices, and what you'll see is that fluid will come off pretty quick too when you cut out those foods. But it's a good idea to weigh in every now and then. So when you call for your telemedicine appointment, if you have your weight, your blood pressure, your pulse, your oxygen saturation, and your temperature, it's really helpful. Those are all signs. Symptoms are more subjective. It's good to write down your symptoms beforehand, because sometimes when you get on the phone, or you get on the telemedicine visit, it's a little nerve-wracking and you forget to talk about certain things. So write down your symptoms. If you feel tired, if you have pain, if you're dizzy, if you have chest pain, indigestion, GI symptoms, rashes on your skin, how are you sleeping, and your mood. All of those things are difficult for your doctor to determine through the phone or through a telemedicine visit, and so you want to have those things ready to talk about. Signs and symptoms are really important to determine if there is a disease process going on in the body. They are not diseases in and of themselves. It's an interesting thing because people will say, I have high blood pressure. High blood pressure is a sign that there is an underlying imbalance or disorder in the body, possibly a disease, but it is just a sign that something is not right, like a hormone imbalance, maybe a problem with the heart, a problem with the kidney, possibly even something as simple as dehydration. But it is a sign that should be paid attention to before it becomes a disease or before a disease goes unchecked for a long period of time. So recording your signs and symptoms, reporting them to your healthcare provider, and then having a really good discussion about how to look for or how to prevent disease is something important that we should all be doing, even from home during this time. So I hope this is helpful, and I hope you're staying healthy, and we hope to see you soon. Take care.